stayed with us as we navigated the technical difficulties. I'm Kyle Lang, the Canby Area Chamber Executive, and we are here at our annual monthly luncheon online due to COVID constraints due to gathering. And I'm going to go through a couple of chamber announcements real quick, and then we're going to join in conversation with our County Commissioner, Martha Schrader. But to start, it's always great to start with gratitude. And so I want to start with an acknowledgement of our presidential level member, Direct Link, for their support as always in helping us fulfill the Chamber's mission of being a resource to the local business community in Canby and beyond. And then I'd like to also give thanks to my 2020 Board of Directors. We'll begin with the president this year, which is Terry Giesick of Gustafson Insurance and Frontier Golf Course. Our first vice president, Jim Davis from Canby Fire. Second vice president, Tyler Nizer from Clackamas County Fairgrounds and Event Center. Our secretary treasurer, Diane Harbeck from Better Homes and Gardens Realty Partners. And then the rest of the board to Tina Schimpf from Hope Village, Joel Cutsforth from Cutsforth Market, George Martinez from U.S. Bank, Mallory Gwynn from Gwynn's Coffee House, Mace Peevler from Wilson Construction, and then a nod to our past president, Carrie Olin of Promotional Strategies. Thank you for their insight, their guidance, their willingness to serve. They have been indispensable, basically, during this time, and answering a lot of my questions via email. They've been so prompt, so responsive, and so I just want to give them thanks for that. Couple of things that are coming down the pipe. We are still running our leadership training series. We're doing that online, and our next event is in 2 weeks on Wednesday. It's using DISC for effective communication, and so there's still time to sign up for that portion of our leadership training series. I have a meeting later this week for rescheduling our Canby Employment Expo. So we're looking at how we're going to get that event off the ground and get our local job seekers and our local employers together in a room together so they can find each other for mutual benefit. So stay tuned for news on that. We're very excited to be bringing that event to town. And to our employers who have signed up for that event, they are pushing to make sure that that happens. And so without them, none of this would move forward. Briefly, I would like to just make a quick comment. We're living in interesting times. We've been working our way through the COVID-19 situation, and through the last couple of days, we've been seeing a lot of extraordinary events in response to police violence, treatment of minorities, trying to vet through what is legitimate protest, versus what is criminal, and we're sorting through a lot of information and wrestling with some really weighty issues. And in light of that, I would just like to reiterate and call attention to a committee that the Chamber started about a little over a year ago, which is the Chamber's Diversity and Inclusion Committee. We meet in order to discuss the issues and have hard conversations about the issues that face our community. And I would just like to take a moment to read that mission statement for that committee. The mission statement reads, "The Canby Area Chamber of Commerce Diversity and Inclusion Committee acknowledges the vast diversity of our community. Canby's competitive advantage is that we promote an inclusive environment, reflecting the full spectrum of our community as a key to the success and strength of our businesses and community. The goal of this committee is education, advocacy, outreach, and inspiration." As we sit in this moment in history right now, if these are issues that are important to you and these are conversations that you're willing to engage in and want to participate in, reach out to me personally, and we can connect you up with that committee work. I think those conversations are going to prove essential as we move forward. So wanted to call your attention to that. And I think that's it in terms of kind of chamber announcements. I'd like to switch gears here and open up the conversation with Commissioner Martha Schrader. Commissioner Schrader has served continuously as a Clackamas County Commissioner since January 2013. She previously served from 2003 to 2009 and as chair from 2005 to 2007. Martha represented Oregon's 20th District as a state senator from 2009 to 2011. And just to kind of give some insight into just some of your works, I'd like to read through the priorities as they're listed here. Some of Commissioner Schrader's priorities are working to enhance the Willamette Falls area through her work on the Willamette Falls Legacy Project and Willamette Falls Lock State Commission, promoting Clackamas County's international trade opportunities, collaborating with Clackamas Community College to create a pipeline for youth into the workforce, the issue near and dear to our heart. Another one, growing jobs and the economy through cross-laminated timber technology, supporting local business expansion and retention activities, and addressing regional housing needs by pursuing greater affordable housing capacity and tackling the ongoing homelessness problem. And just personally, I would like to say one of Commissioner Schrader's greatest accomplishments would be her daughter Claire, who I had the pleasure of going to high school with and skiing with on the Canby High ski team. So for that particular accomplishment, I thank you. Yeah. So we're going to turn it over here and kind of switch gears and join in conversation with Commissioner Schrader. Is there anything, do you have any kind of opening remarks for the chamber that you'd like to begin with?
Well, you had given me a number of questions, which I'm going to do my best to answer. I
Sure.
just want to say that the saying, may you live in interesting times, is really coming true right now for all of us. And I never thought that I would be in such a leadership position at this point in time when we really are facing a number of challenges, particular, the COVID-19 situation, a pandemic, unrest in the country right now. But I'm here to tell people that I believe, I've always felt that local government, and that means counties as well as our cities, are really are very, very stable forms of government. We're the boots on the ground. We're the closest to the real people. We have to go to the grocery store like Cutsforth, and put a plug in for Cutsforth and see our neighbors and our friends every day, no matter where we are. And so we are we're accountable and steadfast. And if I was to give people advice right now, I'm going to quote Claire from England. That's where she lives right now with her little boy and little girl and her husband. They're in lockdown too, by the way. I talk to them every other day on FaceTime. But the English have a saying is stay calm and carry on. And I think that is very apropos for the times we're living in right now.
Right. Okay. Right. So, I think, it's very easy to be overwhelmed with everything that's going on right now. And I think really, if we want to help, a lot of times we need to begin by helping ourselves and being calm and balanced. And sometimes that means kind of turning off the 24 access to information and really kind of rooting and grounding ourselves locally. It's the best way to be, and I am proud to say I do think that we have a team now at the county, and we will continue to have a team. We'll have some changes at the county, but we'll pledge to work together well and work together for the good of our citizens. So, perfect. Thank you so much for being here. I just want to reiterate again. Begin with gratitude, right? I just want to thank you for making time for us. So we have a couple of prepared questions, some that came from membership, some that came from our Government Affairs Committee. And so I think for most people, the reopening of Clackamas County and how we move through the COVID pandemic and where we're at in phase one, I think that's a great place to start because for a lot of folks, that's primary. So the first question, for many in our community, the movement into phase one has been a welcome movement. Can you explain to our viewers a little bit about the process and considerations commissioners needed to weigh in order to make that call? What were the main concerns for you as a commissioner?
Okay. Well, first, let me start with a little bit of data before I get into
Sure.
answering the question, just so people are aware. I just talked to our Emergency Operations Center before coming here. I'll talk a little bit about what that means, too. And as of yesterday, our numbers are that we have 317 positives, okay. Of COVID-19, 11,934 negatives, and 11 deaths. So comparatively speaking to other areas, we have really been able to what we say flattening the curve. And the other thing that we are doing right now is what they call is contract tracing, and I will get into that in a moment. But let me start by telling you basically what we did. We were one of the first counties to shut down. That was mid-March. I had just gotten back from a conference at the National Association of Counties. And it was a wonderful conference, but most of the conversation did center around COVID-19. We did hear from the president. We also heard from Dr. Fauci, who I think has been a hero throughout this pandemic. So literally, I came back home after seeing it start there and the information starting, and came home to where, whoa, we think we're going to have to do an immediate closure, which was tough to do.
Right.
I mean, that's a shock to a lot of people. But I believe one of the reasons we have the lowest numbers right now in the region is because we did it. We made the tough choice.
Right.
So we are in phase 1 of reopening
Yeah.
at this point. And so on May 23rd, Governor Brown okayed us to reopen our county. And what does that mean? It means that we're easing restrictions on local gatherings of 25 people or less, while maintaining social distancing, and Kyle and I are examining that right now.
Right, exactly.
Okay? We're 6 feet apart. Also, a suggestion is I have 2 masks here with me that I wear, regularly. So when you are out and about, particularly when you're shopping or going into other areas where there are people, social distance, and make sure you have a mask. It really protects other people just in case that you have something, actually. And make sure you're constantly washing your hands. Okay, and sterilizing your hand. I mean, any way you can, just wash. The trick is to sing happy birthday twice, and then you know you've cleaned your hands long enough to do that. Very simple, low-tech things to prevent yourself from getting infected.
Right.
Okay, so businesses that have opened, you can check the state's website, but they have to make sure they meet all the guidelines, okay? But the businesses that have started to open now in phase 1 are dine-in restaurants and bars, tasting rooms, tap rooms, and distilleries, personal care businesses such as salons, barbers, and masseuses. And you've seen that I saw the hair shop here. The salon was open.
Head Case Salon.
Yeah, it was open and doing that. Gyms and fitness centers and malls and shopping centers. So we have met those criteria, and the governor has allowed us to open up as of May 23rd right now. How did we do that? We have an emergency operations center that's based on the county campus. It includes folks from emergency operations. It also includes folks from our facilities. It includes folks from Department of Transportation and Development. It includes folks from Human Services. Each one of them has a set duty to really help us move through this crisis. Right. In particular, our Health and Human Services folks have a GO team, which is helping people who are dealing with mental health crises, and they will actually go and distance, but be able to help people if they're undergoing a crisis of some kind. And as I said, disinfect surfaces, hand washing, wearing the mask when you're out and about. A lot of these measures are measured at the county level, but others are measured at the regional level. And what do I mean by that? We are part of a larger healthcare region.
Yeah.
So that includes Multnomah, obviously Clackamas, Washington. It includes Clatsop, Tillamook, Columbia County, and then Washington across the river as well. Yeah. The county, Vancouver, okay?
And so that's like the grouping of hospital capacity across a broader region.
Exactly.
And I think a lot of people kind of get stuck in that, understanding that piece.
What they have to understand is that some of our more rural counties don't have a hospital system in quite the same. They may have clinics, they may have primary care. But one of the key things is we've done well here is we have not overwhelmed our hospital systems. Right. Okay, and that's important because when you want to see how things are overwhelmed, just look at New York. Right. Very worried. I have family there. They're all okay. But there was definitely an overwhelming, and we have to make sure that if we flatten the curve enough, if people need to be hospitalized, that they get what they need. And our first responders, fire, police, and our hospital folks have
EMT.
everything they need, the EMT, to protect themselves from the virus. So we've managed that pretty well, and we're pretty much in the middle of phase 1. So we could potentially move into phase 2 by June.
Right.
And I do have information, it's hot off the presses. I got it in an email this morning, so
Yeah.
I'll open the email, but
Yeah,
let you guys know.
I did, somebody forwarded me a letter from the governor that went out in terms of phase 2 and talking a little bit about what that capacity looked like. It wasn't a lot of information in terms of what phase 2 looks like. It was more like the process for how one moves from
Right.
phase 1 to phase 2.
And that's kind of what I'm going to try and find now, because we have, okay, I think I have the region situation status report here. Yep, I just saw it today, letter to leadership. Oh, let's see. I want to make sure I give you accurate information. That's the
Yeah,
reason
so
why I'm scrolling here.
One thing
But,
that I know that I pulled from the letter was that so once one enters phase 1, 21 days is mandatory before
Right.
any kind of movement
Absolutely.
into phase 2. And one thing that I just kind of noticed was that counties are able to apply a
Yes.
week, so 14 days into the 21-day
Yes.
process in order for
And
that
we're-
application to hit and be processed by the time we hit.
Right, and we're in process of
days.
doing that. That is why we have the Emergency Operations Center, and Nancy Bush is in charge. So what we do, the issue is, we just found out like yesterday,
Right,
today.
right.
What does that mean? Because we were all waited in bated breath, and from what I read, it seems as if we're doing what we're already doing, only bigger and better. Does
Right.
that make sense? The contact tracing is key,
Yeah.
Kyle. Okay, and what is
And
that?
that was the
until-
expanded criteria
Yes,
piece in that
that was a
letter.
huge thing. The contact tracing is huge, and that's where we're really pushing back on the state to make sure we get reimbursed for that.
Right.
Because this has not been something that we have a public health department, but this is the first time we've had to move in that direction, where we have to hire medical professionals with a skill set in order to, if someone is tested positive, they have to get on the line. It's like being a detective. It's
Right.
detective work to find out who they've contacted, who else in the household has been exposed. Does the household need to be tested? Who's positive there? And then from there on out, you can see it's like a big chain reaction that gets bigger and bigger.
Linkage and linkage
And
and
it's
linkage.
linkage and linkage and linkage. And that was our biggest thing, was to, really get to that level where we had the hiring capacity. Oftentimes it's RNs, it can be retired physicians, nurses, people with medical skill sets to really help us ramp that up.
Yeah.
Because contact tracing is one of the things that will help contain. Then we really know specifically who needs to get isolated.
Well,
pretty
and
much.
it's just like so many things that with knowledge comes prudent and actionable actions. Like if we know who's been infected or who's been in contact with who, right? We can
Yep.
we can begin to make sure that they're not continuing to make linkages and linkages and linkages out within the community, and
Exactly.
at least inform them
Right.
that they are a potential infection threat
Yes.
to others.
And remember, there's been people who have been, this is a very terrible virus. I mean, this is nothing like I've seen before, ever. It's not only lung, evidently, it also causes other inflammatory conditions as well. At least that's what it seems. And I'm certainly not a medical professional, but I know,
Yeah, me either.
I have a biology degree, so I know enough to be dangerous, is what I tell people, okay?
Right.
So I've got some basic biology, but people need not to take this lightly. This thing is it's a vicious virus. And when someone's asymptomatic and they're potentially spreading it, that is extremely, extremely dangerous. And it seems to affect people differently. Some people get a light case, other people really are ending up in the hospital with oxygen and BiPAP machines and other things. So take this very seriously. This is not a drill.
Yep. I mean,
Not a drill.
a woman I went to high school with, we're in our 40s, but very healthy and active and fit. And, I mean, she's basically in day 60
Really?
of COVID.
She got COVID
and
in
she
day
got
60?
it, and
Wow.
she's in like 60 days, and it has been, and the symptoms moved and morphed and changed, and every time she thought she was kind of over the hump, it kind of hit again. And
Yeah,
so,
it doesn't. It's a really dastardly. It's like nothing we've ever faced, and we can only hope that the move to get a vaccine seems to be going relatively quickly. But I still would suspect that's at least a year to 2 years, at least 2 years out. I would suspect, maybe sooner if we get lucky.
Yeah.
So.
How about, can you give us an update on Clackamas County services? Has there been a move to reopen county services in phase one, and what does that look like?
What we're dealing with now is particularly that's a facilities issue, okay? And we have kept services open virtually, okay? So that has happened. We have the buildings, our campus is still physically closed, okay? But what we've been doing there is having our facilities management come up with the criteria of what we need to do to reopen, and that would mean what we're doing. All right, if we meet, we're going to have to be 6 feet apart. Masks. They're going to require people to wear masks when they're,
Within
maybe
the building.
if I'm alone in my office. Maybe not so much, but if
Right.
somebody comes in and I'm walking around, I want to make sure that I have the appropriate mask on with that. Constant. How do we disinfect?
Yeah.
Okay, bathrooms and bathrooms that are open to the public as well.
Right.
So we have to get those protocols in place. So it really is it's really a safety protocol that we're working with. And as soon as we get those protocols worked out, I would say that we would at least open it for our staff. And don't think our staff have not been working. This has changed how we work. We do Zoom meetings constantly, and that not includes your county commission that's making decisions and moving forward. This is our county staff as well. Is all. We are not on furlough. Let me put it that way.
Right.
Okay?
No, my wife works for Tycor Title, and she works in land development and builder services, and she records plats and records documents with the county all the time, and that hasn't stopped. There's been a logistic change to how it operates, but deals are moving forward and things are open.
Yeah, and I think that's important.
So
That's right.
I didn't mean to kind of indicate that it was shut down, but more broadly.
Okay.
So how about, can you provide an update on the critical numbers as you see them now that we've been open for a little over a week? Where are you seeing movement or lack of movement around the county?
Actually, we're still seeing it as relatively low.
Yeah,
as
good.
long as people, and I gave you those numbers those were of yesterday, so you did get the numbers to start with.
Right.
We're not really seeing a major uptick so far.
Good.
That's a good trend. Okay, we are seeing some cases, but it's not like this explosion.
Right.
I am a bit worried with a lot of the unrest that's been going on that people have not socially distanced, so I don't know what that's going to mean. It doesn't seem to have hit our county as badly as our neighbors to the north in Portland, but I wouldn't be surprised if I saw an uptick from that.
numbers from that.
And it's a social contract too. You have to tell people, please, for the good of other people, you have to think of your community now with how you do this. For instance, I did get a call over a restaurant that evidently was not following the rules. And I checked to see what we could do. And no, we're not sending our sheriff out. We're not doing that, but we have to take those complaints and we have to put the social pressure on one another to follow these guidelines.
Right.
Okay.
It's conversation and it's education and it's
yeah. And it's really thinking of the community. I mean, there's a lot of individualism to go around, and that's not a bad thing.
Right.
However, in times like this is when we start thinking about the other person, the well, and community is important. So think of it as a community duty to make sure that you're safe and actually other people are safe. So.
Yeah. Good. One of those critical numbers, and you touched on it a little bit in terms of that contact tracing. I know there was a threshold for the minimum required for the county. What is, do you know the current number we have versus that number?
I believe it's about, we felt about 60 people. And so we have hired up. And what we're waiting for is, as I said, this was not part of our anticipated budget.
Right.
So the CARES dollars from the state is supposedly, we hope. I mean, we're being told, okay? We're being told by our governor, we're being told by those folks at the legislature that we will get reimbursed to help us out with that public health piece of
kind
what
of
we're
that
doing
mandated.
right now. It's mandated. It's mandated.
Piece.
And that's what the dollars, I mean, it's part of what the dollars are for, though, is to help local governments staff up at this point to do what we need to do.
Yeah.
Because there is no magic money tree out there.
Right.
There's no
I have yet to find one.
I keep looking myself, but
Right.
no, got to balance the budget
So
every year.
do you think we're, almost there in terms of hiring?
Yeah. Oh, yeah.
Close?
Oh, no, we are. We've already hired.
Oh, you've already hired?
We've already hired
You've
people.
hit the mark.
Yes,
Done.
we have hit that. We could not
Okay.
have reopened if we hadn't hit that threshold mark.
Okay.
Okay, no, we have hired and we have people actively
Perfect.
contact tracing, yeah.
Awesome.
There we go.
In the initial application, the areas that were in progress were housing for those who could not self-isolate and PPE
Right.
supplies for first responders. Can you give us an update on where the county stands in those categories?
Well, basically what we've done is we work with a lot of our hotels, and we have vouchers.
Oh.
And people who are ill and need a place to go, we have been attempting to use those vouchers and get them into a hotel. And I want to thank our hoteliers in this county for their help with pulling that together.
Yeah.
And that's probably the hardest thing to do is people who are houseless or homeless who test. Although, frankly, they just did what I heard in Portland was that they actually did contact tracing with their homeless population, and they only found like 6 people positive. And I thought that was a very interesting. I don't know what that means,
Right.
but that was good to know. You might expect it to be more spread than that, so that's a positive, I think. But yeah, that's essentially what we're doing with housing. With protective equipment, we've been very lucky that we have worked with, believe it or not, the Chinese American community has given us masks. And also, I'm a member of the Oregon-China Council because I've been working on international trade issues, and they were also able to ship to our facilities group a number of masks and also protective gear. So that's been
Gowns
a very
gloves
very positive thing. That to me, when we're talking about equity and diversity and how we should react to this, that when our friends and neighbors from our Chinese community, Chinese American community, and actually friends that we've made in China, they are really trying to be helpful in helping us meet those equipment.
And now that's an ongoing relationship
yes.
in terms of being able to kind of a pipeline for those types of supplies.
Absolutely.
Yeah.
Absolutely.
Yeah,
So
good.
that's been a really positive piece of this, I think.
Yeah.
So.
Lovely.
All righty.
Do you or the commissioners have concerns about the transition to phase 2 within the 21 days?
Go ahead, finish.
Yeah, and just are there any trends that you see as promising or troubling?
I would say right now it looks promising, and
Yeah.
a little bit, again, I wish I could find it came directly today, and I can't find the email right now. But
From Kate?
but from phase 2.
Governor Brown?
Governor Brown, phase 2, our administrator put it out because that's what we've been waiting for. We've been waiting for basically, okay, what does that mean? What does that mean? And let's see here now.
Here we go. I
EOC
think I have it
situation.
here. The letter for county leaders
Yes.
from Kate Brown's
All
office.
right, let's read it off then.
Subject
Yeah.
process for entering phase 2. So just a letter of request to move into phase 2 must contain the date the county is requesting to enter,
Right?
a reattestation that county first responders have sufficient personal protective equipment, the number of trained contact tracers currently available to the county, and any substantive changes to responses submitted in the Phase 1 application regarding meeting Phase 1 prerequisites. So that's basically the content of what.
So what I thought when I read it, but I don't have it memorized, but when I read it, I thought, oh, it's more of the same. In other words,
Right.
it's putting it on steroids a little
Yep.
bit more, and really just keeping to following through. And if we're not seeing an uptick, that's a good sign. But now
Right.
remember, that's not going to be until about, let's see, we opened up May 23rd.
23rd.
So what do we got for the date? Probably mid-June,
12th?
21 days? Yeah, mid-June.
Yeah,
Which
around
is
the
int-
12th
which-
somewhere.
Which is interesting, because I said that.
Yeah.
I thought.
That's the number
people
you had in your
kept people kept saying, well, when's it going to do? And I thought, oh, it's going to be mid-June. It's
Yeah.
going to be around the 12th or
Right.
the 15th. And I thought, good
So
job.
it reiterates the original prerequisites that you were able to lay out
Yes,
for us
exactly.
earlier. And then there is a section that says additional criteria required to enter Phase 2. And it says OHA tracks this data. Counties should consider how they are meeting these criteria before requesting to move to Phase 2 and describe mitigation efforts when criteria are not met. And so timely follow-up. A
Yep.
minimum of 95% of all new cases must be contact traced within 24 hours as reported by the state's Orpheus system over the previous 7-day and 14-day time period.
Yes.
And so we're staffed up and going.
We are
right?
staffed up and going, and so that threshold, as I said, we meet. The other thing you should know is we do meet at noon. I'm missing it today, by the way,
Yeah.
because
Well,
I'm with
thank you
you
for- I
guys.
thank
But
you
that's
again
okay.
for being
That's
here.
okay. That's
Yeah.
okay. But we meet with I'm vice chair this year of the county, so our chair and I meet with our emergency operations
Okay.
coordination team usually at 11 o'clock every day.
Okay.
And so every day we have a specific update, which is how I got those numbers
Yeah.
to you today. So we are constantly assessing those kinds of questions. And that's the kind of thing that now that we have finally the guidelines,
Right.
we just got the letter, okay? Now that we have that, we'll be working with our EOC who will tell us, yes, we're meeting those metrics,
Right.
or we need help meeting these metrics. And that's really how the operation works.
Okay.
Okay.
Perfect.
Yep.
The other point was success. It's a timely follow-up, and then it says successful tracing. A
Yes.
minimum of 70% of new COVID-19 positive cases must be traced to an existing positive case over the previous 7-day and 14-day time periods.
Yeah. Pretty
Okay.
much. The contact tracing is the key element of this, because without it, as I said, you can't stem the infection rate. That's really, that's just common sense.
Yeah.
And the fact that we had to gear up for this, if we could have done it even sooner, of course, anything sooner. And we made a wise decision by shutting down early.
Right.
We really did. I know that might have been hard for people to understand. I am very pro-business, so I was really cognizant of what that was going to do, the impacts to our economy.
Yeah.
But you have to judge human life and safety as well as balance that with the
Yeah.
economy. And we do also, for what it's worth, we do have a business where we're putting into place a grant program.
Oh,
So there's
excellent.
more to come on that
Yeah.
if we'd like to get that. I'll get the link to you about
Yeah.
how that's going to work. Okay, we've probably got, I think, about $400,000 for that
Okay.
to at least start from our perspective to start giving out grants to businesses as we start to reopen up a little more.
Do you know, and maybe it's too early, do you know if that grant program is specifically meant to target those who maybe did not qualify or did not receive
we are looking
federal?
we are looking at the smaller businesses, 25 and under.
Okay.
Diversity and equity is a piece of that, but I'm
Sure.
sure we can meet that criteria. And the other thing that our economic development department has done is that we have a map. And you can go on the map on our county website. And as a business, you can put yourself on the map and say, we're open.
Yeah. Oh, the Who's
Okay,
Open.
the Who's Open one. That was another
The
year-
GIS
yeah.
centered.
Yeah,
Yep.
that was a couple of our responses to this, at least from the business standpoint. And I'll be glad to get you more on the grant application process
Yeah,
as soon
as
as we
that
get
stuff
that.
rolls out.
Okay.
Because I know these programs are are maxing out fast.
Yes.
And so, right, early access, I think, for folks is critical.
It's pretty important. So I moved us to business, so anyway.
Yeah,
that's
yeah,
okay.
no, that's good.
But the contact tracing, to me, for phase 2 seems to be the element that really needs to be ramped up. That's kind of what's going on with that one.
And so then in terms of this next piece, it seems to be kind of case data or incidents of increase. So no increase in incident cases or positivity. There cannot be a 5% or greater increase in new cases in the county over the past 7 days, or there cannot be a significant increase in the percentage of positive cases out of total tests taken in your county over the past 7 days. So they're just watching the needle on the spike.
Right now it is needle watching, yes.
Right.
With those sets of criteria that they have set forward, I can guarantee you that our staff today is right on top of it. They have been, I can't say enough good things about the people that work for the county. They have been absolutely phenomenal. I mean, they have been at this 24 hours a day, day in and day out. The Emergency Operations Center and the team that they pulled together has kept this county safe. So I'm not going to take credit for that. It's really the people that work for the county and that are so diligent and really care. I mean, it's been a humbling experience to see these people just manage to do what needs to be done for the good of everybody. They deserve.
Yeah, so the city, the city of Canby had their own emergency operations center, right? That kind of rolls up in the hierarchy, and I got the opportunity to work with them, kind of in the recovery department within the EOC, and attend some of those meetings and be in on those conversations. And their work is attentive and diligent and selfless, and they're
the selflessness.
remarkable.
That's what saves us. That's community.
Right.
That's really community.
That's where it's at.
Yeah.
So, and basically those are the criterias for the county application to move into phase 2. There was one little caveat about the percent increases, in that if there was a controlled outbreak in a group living environment, that it wouldn't it would kind of be removed
if it was a controlled environment. And the other thing is that the Oregon Health Authority is finally letting us know, evidently putting out information where there are larger outbreaks in businesses, or I know that they've had lots of issues with food processing plants. I know that we've had that's nationwide, but I know that we've also had some folks on one of our farms with our farm workers kind of having an outbreak too. So we're trying to keep an eye on that, since we are a rural county with a farming community.
I mean,
we
really straddle that rural kind of urban metropolitan divide.
Oh yeah.
And so we have both sets of concerns, right? Both
we've got the density
of the
piece,
urban,
and then the rural, and yet
the agricultural,
agricultural, who are essential workers in my mind too.
Oh yeah.
So
absolutely.
And I have yet to. I know the governor has released dollars to help farm workers. I was reading that this morning before I came over, and one of the things I'd like to do is get more details on that, because we are a rural county, and that is a population that having farmed here for so many years, I have an affinity with housing and healthcare for those folks. So.
I was just having a housing conversation earlier today.
Really?
Somebody called in asking, kind of, where's that going, right? Amongst all of this, like, is that a conversation that's still happening? And the answer is yes.
Yes.
Absolutely. Okay, so we're about 15 minutes away. I'm going to shift gears. I had a question from my Government Affairs Committee, and it's rather lengthy.
It's okay.
So
I'm prepared for
it.
I
sent it to you so you'd know I was coming with this one. So the question as it was given to me reads, Commissioner Schrader, PDX and the airlines are seeing record low operations because of the pandemic, mostly due to the fact that airline travelers are seated in close quarters with other unknown and possibly infected travelers. At the same time, general and corporate aviation is anticipating a nationwide uptick in use due to their ability to transport medically fragile individuals in seclusion, move essential business employees while keeping them isolated, and deliver critical medical items as well as emergency delivery of parts for essential business operations. Aurora Airport is usually the fourth, and sometimes, depending on the day, the third busiest of all the airports in Oregon, behind PDX, Hillsborough, and Redmond, in flight operations. Knowing that Aurora Airport and the businesses and flight departments based there contribute massively to businesses and families in Canby and Clackamas County, why has the Clackamas County Commission directed and is currently spending county citizens' valuable tax dollars to pay county in-house legal staff to fight the Aurora Airport, an airport that is not even in Clackamas County, it's in Marion? How do you stand on this issue, and would you work with incoming Chair Smith and fellow Commissioner Savas to direct the county's legal staff to withdraw from the litigation?
Okay, so let me clarify that to
Right.
start with. Okay, we are a nominal party to the LUBA appeal, okay? That's what this
Land
is.
use.
Yes.
Yep.
Because it's concerning the Aurora Airport. Why do I say nominal? Because we're not doing anything. We essentially just signed on in name only, and it was at the request of the city of Wilsonville. And even if we were to withdraw from the appeal, there are 5 other parties. There's Wilsonville, there's Aurora, Thousand Friends, Friends of French Perry, Joseph Schaefer. That appeal is going to continue. Okay, and the bottom line is that from my perspective with this was a courtesy to one of our cities that asked us, because the biggest issue we're having with the Aurora Airport now, this process, is there is a feeling that the appropriate process for land use was not followed in this case. So it's more of a process issue for us than it is anything else. And as I said, if people are concerned that we're spending taxpayer dollars, we're really that's not
That
so.
hasn't been the case.
But what has happened is we have residents in the area that have not felt heard. We've been consistent. We believe the Department of Aviation needs to follow the state land use laws, and that's what this LUBA appeal is about, okay? The other piece of this is that it's a conflict between, I think, what you want to do for our businesses as an economic development and kind of piece, which is the airport.
Right, support the businesses
we know
that are
that
using the
we know
service
that
and-
that's an economic driver.
Right.
But also what we're dealing with as commissioners, since it isn't just, everybody, it isn't just us, is
Right.
that we have a very large vocal constituency in Charbonneau and Wilsonville
Right.
that believes very, very strongly that this is going to affect their quality of life. And that means with with planes flying over, noise, pollution, so on and so forth. So they have kind of led the charge. And the other piece of this is that Wilsonville has not wanted to do anything south of the river. That's
Right.
been, and that would mean, because the other issue we have is that airport, well, it's even more complicated because it isn't even in our county. I mean,
Right.
it's whatever. So
Right.
the expansion would happen in Marion, but it's also going to affect our constituents. So what we've been really trying to do is to at least give those constituents some representation as the process moves forward. They really do feel very, very strongly about it. It's what I've seen. The other issue, from a very pragmatic standpoint, from my perspective as a commissioner who has to deal with taxpayer dollars,
Right.
okay, any expansion there is going to need lots of dollars for the intersection exchanges.
Infrastructure.
And right now, I've got to be honest, pragmatically, whether I'm yay, nay, or in the middle, I don't know where that magic pot of money is going to come from at this point, because basically our transportation system would be overwhelmed there, and that we'd have to get something. It would have to be state dollars. Right now, none of that's in the queue.
Yeah.
Okay, none of it's in the queue.
So the intersections we're probably talking about are like Ellen Road
Yeah.
and Airport Road
Yep, and
all that
that
I-5
would, with an
access and-
expansion, yeah, you'd have to see an expansion of access, and which wouldn't be more business, more traffic.
Right.
And right now, the other thing is it's unincorporated in Marion County, so we have a policy at Clackamas is we do not want to urbanize unincorporated areas. We want a city to annex. an area if they want to do these kinds of things. So who would that mean? The closest are Wilsonville and Aurora. Both of those cities at this point, at least as of today, really don't want to go there. So you kind of have this no man's land in an unincorporated area without infrastructure. That's the real long-term barrier to this. And I have to tell you, as a commissioner, we're focusing our transportation initiatives right now on the I-205 bottleneck and the Abernathy Bridge, and also the Sunrise Corridor, which is it's the one out on 212.
212.
Okay, or the Sunrise System. We used to call it a system. We call it a corridor. Now we're calling it the Gateway. It changes names, but the bottom line is that's our highest growth area in the county, and so
Heading
those
out towards Damascus,
yes,
and those big
right.
Happy Valley, those
where
big kind of
it's
residential growth.
it's exploding. So right now our lobbying has largely focused on those areas of infrastructure. Now that could change. But I think we need to wait and see what happens with the LUBA appeal. Maybe when our new colleague comes on board, we'll revisit that.
Yeah.
I have a very good working relationship with Commissioner Chavez, so we could probably talk about it. But I would just say even logistically and with money and with what would have to happen with infrastructure, I have no idea. There's no pathway to get there.
Gotcha.
That's
Just for
it.
historical context and understanding, I know a lot of people probably don't even know kind of what LUBA is or what that process.
Land Use Board of Appeals.
Land Use
It's a
Board of
land. It's a
Appeals.
land use issue.
Yeah.
It was.
Do you know where the process break was that is the source of the appeal?
I think that I think my impression is, I don't have all the details.
Of course.
But I believe it was kind of turning more into a supersiding kind of a thing, and I think that upset people. Okay. That seemed to be like, the Department of Aviation evidently was attempting to say, well, because this is I imagine they think it's an essential service, which it is. I mean, in many ways that they were not, but we'll see. I mean, that's what's going to come out in the LUBA appeal, pretty much.
Okay.
And I don't know what's going to happen in the future because I think that there are changes in Wilsonville, and maybe that will change the tenor.
Right.
But I don't know.
Right.
I don't know.
And that really, because the airport's been on
This has
our
been
minds for
years.
long
Years.
time.
Years.
And
Years.
it is so hard because it is intergovernmental. There's there's layers
Yes,
and
there's layers.
complexity and trying to get everybody on board together.
It's complicated for us because yes, it's in Marion County, but then there's the road, and then there's our constituency in Wilsonville and Charbonneau that feel as if they're already having most of the impact of the air traffic there.
Yeah. And the roads that are in their
And the
transportation
roads and
grid
things.
that-
Yes,
yeah.
exactly. They're feeling already as if they've have as much as they can handle without an expansion. But the difficulty is it's not our county.
Yeah.
It's just across the road,
Right.
And
Literally.
And from a business perspective, yes, airports are economic drivers. I mean, there's that. But how do you balance quality of life with the economic drivers? That's the issue we're dealing with when you think about it.
Which economic drivers,
Yeah.
right? Influence influence quality of life, right? So it's, what is it? The Gordian knot, right?
Yeah,
How do you untangle
it-
these things?
That's basically what we're dealing with is a Gordian knot with this one. And it may be when our new commissioner comes on board that we readdress it.
Right.
But at this point, don't worry about our taxpayer dollars because they asked us as a constituency to join them. We did out of respect for our cities, for Aurora. Well, Aurora's in Marion County too.
For Wilsonville.
But yes, for Wilsonville, and we'll see where that ends. But we are not actively spending any money pursuing that. That is really there. Yeah.
They're leading the charge.
Yeah, and we made it clear that we weren't going to do that too.
Yeah.
We made it clear when we were doing it. So there you go, leading the charge.
Yeah. So last couple of minutes that we have here, is there anything else that we haven't covered from the county that you see as important? I know you guys have been focusing on internet, telecom infrastructure as a major issue facing the county.
We've talked to our superintendents, and what I would personally like to see happen is that we talk to our smaller providers and see how we can collaborate on getting grant dollars from the federal government in order to increase access across the rural areas of this county. I think that's key.
Which are expensive.
It's a big equalizer. We have talked about our own ISP. I personally don't think that's the first step we should take. I think we really should be working more directly with our with our small providers first, because I think when you get a public-private partnership, it's a stronger partnership. So that's kind of where I am. And we'll see how that works too. There's been that. Doing a lot of work with actually getting units built for homeless and houseless people, 30% below of area median income. I have particularly still been working on the Willamette Falls locks issue. We came this close in the last legislature, and then things blew up.
Right.
And the bill to create our own public corporation, never got through the system. It passed in the House and then died in the Senate. If we can somehow resurrect that, there's still hope that we can work with the Corps, get the repairs done, and actually open that up as part of that whole, vortex of history and legacy and everything else that's going on around the floor.
And I mean, it really could be a driver for the broader region up and down the river.
Right. And tourism has taken a big hit too, by the way.
Immensely.
A big hit. People need to be aware of that. It will recover at some point, but because of COVID, the transient room taxes have not been coming through. So we have had to scale back tremendously on tourism, but again, when things recover, we'll get that rolling again.
Mount Hood Territory is a great partner to Chambers.
Yeah.
They do amazing work. The men and women who work within that agency, who I've dealt with in the past, utmost professionals. They do a great job, and so. It hurts to see some of those go due to the loss of revenue from that transient room tax. Yeah. But I know they're fighters.
They're fighters. It will come back. They've been moved directly under our administration. We've had to let people go. I want to let people know that we're trying very hard to not let people go. We'll look at furloughs first, but we'll just take our time with that and see what happens. We're trying to keep our folks employed, shift around and do all that management. Yeah, to me that's the next biggest challenge is how we're going to do this. How are we going to? Because COVID-19 has just been a total. We never thought that we'd be governing in the middle of a pandemic. Let me put it that way. So
and you look at state revenue projections, and I mean it's we're in
whatever.
for a battle.
And I do want to let folks know we do have a balanced budget. We just finished our budget process. However, because of the uncertainty out there, we'll be meeting once a month as a full budget committee, and that includes our citizens who are on the budget committee as well. So the commission and the budget, we're really going to have to take a hard look at how things go. So at this point, yes, it's balanced, but we're going to be actually tracking it every month now to see where we are.
As things shift and evolve.
And as things shift. And that's basically, we have to be nimble. This is a time when being nimble and being comfortable with uncertainty are, enough that you're going to just have to deal with it, So.
Well, I want to thank you
for
taking the time
nice to
and missing
see
your
you.
meeting.
This has been
it's a
fun.
pleasure to hear from, all levels of government, and I appreciate the county and you for being here and letting our members know what's going on.
Well, I have a soft spot for Canby. I have 36 years, raised all my kids here, and it's been a great. It's a wonderful community, and I was delighted. I remember you guys at prom. I just have to tell you that. Come up to the farmhouse. So we have a lot of roots here, and I really appreciate your having me here, and I appreciate people trusting me to lead during these times. That's very. I take that with great humility.
Yeah.
Okay.
I mean, none of these decisions are easy.
No, but you just have to be able to, look things in the face, know them for what they are, and just, like I said, move forward.
Yeah.
So.
Yeah.
All right.
Thank you so much. Appreciate it.
And stay healthy.
Yes, please. All right. Thank you, folks. Appreciate you being here.